Hello. Today I'm going to talk to you about celiac disease. Celiac disease is an autoimmune disease that causes damage to the small intestines, most notably the villi, which are responsible for absorption, with the ingestion of gluten. Gluten is found in wheat, barley, and rye, and sometimes oats, but more because of cross-contamination with wheat, barley, or rye than the fact that oats have any gluten in them themselves. Celiac disease is also called celiac spruce or gluten-sensitive entropy. I personally have suffered from celiac disease and have been totally gluten-free for almost 10 years now. It does have a genetic component, and there is stories of my grandmother having to have found special bread, but it's still very misunderstood and often misdiagnosed as irritable bowel syndrome or Crohn's disease, and this can lead to years of frustration for the sufferers, as really the only treatment for it is to go completely gluten-free, and until you're diagnosed with the celiacs, you don't think about that. The pathophysiology of celiacs is that it is an autoimmune disease. So it's a immune response to gluten. And there are three types of celiacs. There's classic, which has your normal GI symptoms of bloating and diarrhea, and which is why it gets misdiagnosed as Crohn's or irritable bowel often. There's non-classic, which you may or may not have the GI symptoms, and you will have some seemingly unrelated symptoms one would never associate with the GI disease, which we'll get into a little bit later as we're talking about the clinical manifestations of this. And then there is silent celiacs, which is the person seems to be anti-symptomatic, but there is intestinal damage happening. There is an autoimmune response to the gluten happening. Most report relief of these unrelated symptoms after changing their diet and being diagnosed celiac and changing their diet. The reduced acid reflux, reduced abdominal bloating, reduced flatulence, reduced joint pain. They're like, oh, didn't know I was suffering from that. So even though it says silent, there's still symptoms. The person just doesn't realize that there's symptoms. There's no rhyme or reason to them. Diagnostic testing for the disease is still in the very early stages. There's really no definitive test. There is blood work that can be done, and it tests for the antibodies, because it is an autoimmune disease, so your body does create antibodies, and it's the tissue transglutaminase antibodies that they're testing for. And your body produces this as a reaction to the gluten. You must be eating a full gluten diet for this test to be accurate, like every single day. And false negatives are very common. And so if you get a false negative and you still suspect it, they can go in and do a biopsy of the intestines. Still not 100% effective because it is dependent upon biopsying the portion of your intestines that actually has damage. So there's a high chance that that area doesn't have damage, and then you get a negative result with that. So there's really no definitive test for celiac. And you can check for the genetic markers, but that's not always an indicator that you're going to develop celiac, nor is it an indicator that you won't, because there are people who develop celiac that do not have the genetic markers for it. So we're still trying to figure out exactly how to diagnose it definitively. This is what it is. So most often what happens is they may try the blood work, they may try the biopsy. If both of those come back negative and you're still symptomatic, what your doctor will suggest is an elimination diet, which means for 6 to 8 weeks, you are gluten-free. Not sort of gluten-free, not mostly gluten-free, gluten-free. A crumb, if you have celiac, will affect you for up to 8 weeks. Trust me, I know it's not fun. So if you go gluten-free and your symptoms disappear, you have celiac. That's how I was diagnosed. There wasn't the blood work when I was first diagnosed, really. And my doctors were like, we could do a biopsy, but we might, if there's not a lot of damage, we may not get the right portion. Go ahead and try the elimination diet, see how you feel. Did that. My brain fog went away. My abdominal bloating went away. All my GI symptoms went away. My joint pain lessened. My migraines lessened. My asthma attacks were reduced. So all these things that you don't think would be associated with celiac, when you go gluten-free and those go away, you realize, oh, they go along. And what they had me do was they eliminate the gluten completely. And then after you've been free of gluten for 6 to 8 weeks, you add in a little bit and you pay attention to how your body reacts. What I find now is the longer I'm gluten-free, the more sensitive I have become. So now a crumb from a cutting board where my husband or son have made a sandwich, that little bit of crumb gets into my food, I will have brain fog. I will not be able to think, it causes me to not be able to think clearly, to not, really kicks up my ADHD kind of symptoms. Very jumpy, cannot focus. The first symptom that I notice is the next morning after I've been poisoned, as I like to call it. My hands hurt. It hurts to hold a pencil. It hurts to pick up a glass. And I will feel every single vertebrae down my back as I get out of bed. Oh, I got hit. And those symptoms can last for up to 8 weeks, depending on how bad of a cross-contamination I got. So I've become very, very stringent on following my gluten-free diet. So because that happens, because I went gluten-free and just little bits cause a reaction, my doctors have said, yep, you're celiac, stay gluten-free. So clinical manifestations of the disease, we've talked a little bit about that. Excuse me. There are more than 200 known symptoms. And the ones that seem logical, it's a GI disease after all: abdominal bloating and pain, chronic diarrhea, vomiting, constipation, pale, foul-smelling or fatty stools, malabsorption, so you would have like iron deficiency, and weight loss, although also difficulty losing weight can be a symptom. So again, while these are all, they've linked them to celiac, they don't obviously seem to fit. Other ones that don't involve the GI tract would be fatigue, bone and joint pain, arthritis, osteoporosis, so bone loss, liver and biliary tract disorders. I had my gallbladder removed at 25 before anybody realized, oh, celiac. Depression and anxiety can go along with this. Peripheral neuropathy, so tingling or numbness and pains in the hands and feet. Seizures or migraines. Missed menstrual periods. Infertility or reoccurring miscarriages. Canker sores inside the mouth, which also goes along with anemia. You'll see that there too. Dermatitis. Dental enamel defects of the permanent teeth. It's got that going on too. Always thought it was genetics. Found out researching for this paper, it might be related to my celiacs. And attention and deficit hyperactivity disorder in children could be a sign. Untreated, meaning, and the only way to treat it is the gluten-free diet, you end up with iron deficiency anemia, early onset osteoporosis, pruritus, the infertility and miscarriage we talked about. Lactose intolerance also usually goes along with this. Vitamin and mineral deficiency, central nervous and peripheral nervous system disorders, pancreatic insufficiency, intestinal lipomas and other GI cancers, which is what my grandmother died of, gallbladder malfunctions, and neurological manifestations, so ataxia, epileptic seizures, dementia, migraines, neuropathy, myopathy, and multifocal leukoencephalopathy. Can't pronounce that. Anyway, the interpersonal professional care that would go on when dealing with a person with celiac would be a nutritionalist, because as stated, diet is really the only management we currently have. Oncology, if it has gone so far as to be enough damage that they have developed a cancer, and then a GI doctor, because it does damage the GI tract, so you'll want to have that taken care of. Treatment plans and medications for this disease. Like I said, diet is really the forefront. Stay away from all gluten, and it's amazing the things it is in. Soy sauce, soups, condiments. It's not just avoiding bread and pasta. And corticosteroids can help with some of the pain and inflammation reduction. Currently, there are some new medications on trial. So you have PRV-015 is currently in trial. This is something that would be combined with a gluten-free diet. So it's not allowing the person to go back to a normal diet, but it would reduce symptoms and inflammation from the accidental exposures. So in a shared kitchen like I have with two people who are not gluten-free, if I were to take the hope is that if I were to take this, then those small little crumbs that might get in my food wouldn't affect me. Another one, which I had trouble finding a little bit more information on this one, but it's also currently in trials, is KAN-101. This one hopes to re-educate the T cells so that they don't respond to gluten antigens. The way this is described, I'm not sure if this would still require the adherence to a gluten-free diet or would allow for a return to a regular diet, which would be fantastic. I miss soft pretzels. I miss bread. I miss pasta. I'm part Italian. The gluten-free versions just aren't quite the same. So that would be fabulous if that's what that one does. But they're still in, I think, stage 1 trials, so that's years off at this point. So nursing care for this patient would focus on education on diet and pain control when poisoned, as I put it. So you would assess, number one, the patient's knowledge and their current symptoms. Are they in pain? Are they having GI pain? What do they know about celiac? What do they know about the gluten-free diet? Once you've assessed all that, then you would diagnose them. And possible diagnosis would include diarrhea related to the disease process and inflammation, ineffective health maintenance related to deficient knowledge of disease management, imbalanced nutrition, less than body requirements related to inadequate intestinal absorption of nutrients, acute pain related to abdominal cramping, and systemic disease process, so like the joint pain that we talked about earlier. Once you've done the assessment and figured out which of these diagnoses fits your patient, then you're going to plan. And for all of your patients, education on diet is ongoing. Things change constantly. Knowing what weird chemical names to look for that are made from wheat or barley or rye is very important. So malt flavoring. For a while, I had to avoid caramel coloring because that was derived from wheat. Artificial vanilla was derived from a wheat-based product. So understanding all of these lists of things, and there's some great resources which you would then provide. One is celiac.org, has a list of all of those chemical and dietary add-ins to look for. So I used to go with my list of everything, and every package I would have to read the ingredients looking for these names to see if it was something I could have. It's gotten a little bit easier now with products labeled gluten-free, but even then you have to be careful because the government does allow for up to, I believe it is 20 micrograms of gluten in a product and still be labeled gluten-free. So really have to still kind of watch what you do and what you get. So education is huge for these patients, and consultation with the nutritionist, because with such severely limited dietary options, the evaluation after you've implemented the setting it up with the consultation, your imbalanced nutrition, less than body requirements, can change from inadequate intestinal absorption of nutrients to restricted dietary intake and deficient knowledge of the gluten-free diet. So they can still have that imbalanced nutrition, can continue based on how they are adapting to the gluten-free diet and how they are managing to get the nutrients that they need on the restrictions that they have. So implementation, you would set up a nutritionist consult, educate the patient on the disease process and need for strict adherence to a gluten-free diet. Again, just a very small amount for a celiac can wreak havoc in their body for weeks. And provide resources to the Celiac Disease Foundation, which is at celiac.org, which I mentioned, and Beyond Celiac is another organization that has some great resources, and that's at beyondceliac.org. So once you've done the assessing, the diagnosing, the planning, and implementing, you're going to want to evaluate them when they come back. And here's where you can find if they are still imbalanced nutrition, less than body requirements, related to their strict dietary adherence now. And if any of the pain or other symptoms are still there, these may last up to 3 to 6 months after an exposure, depending on how big the exposure is. Or if this is their first time going gluten-free, there's a lot. Your body tends to store it in the joints, and the inflammation can take a long time to really settle down. So one of the ways that it was much easier for me as a new celiac to explain to others why, because people were always saying, oh, a little bit won't hurt, or are you sure? Are you sure? It's a lot easier if it's explained as an allergy as opposed to a disease process for those who are not in the medical field. And a lot of times for the patients, they'll get it if you explain it as an allergy, especially if you explain it to like a peanut allergy, because nobody would ever think of offering somebody with a peanut allergy just a little bit of peanut butter. And that you have the same reaction, it's just invisible and internal instead of anaphylactic. So education is the biggest thing for a celiac and their partners and people around them to understand. I had people who would sneak me gluten to prove, see, you're not allergic, it's fine, you're fine. Okay, but now I get to deal with that for 6 to 8 weeks. Thank you. And here's what I'm going to have to deal with. And when I finally laid it out to them, it may not happen immediately the minute I take a bite, but within 24 hours, I'm going to have intestinal issues. For the next 4 to 6 weeks, I'm going to have joint pain. For the next 4 to 6 weeks, I'm going to have difficulty focusing, and I'm going to have trouble doing my schoolwork and my job. Thank you. People are beginning to understand the more that we as celiacs educate the community, and it becomes a more well-known disease process. So I hope I was informational and educational today, and I thank you for listening.